Welcome to this short video on effective training on ventilation. So the question is, does endurance training have an effect on ventilation? Can you train ventilation to breathe more at higher rates during exercise? The lung itself has no, training has no effect on lung structure. In other words, you don't grow more alveoli, they don't get bigger, and the function doesn't improve a large amount, if at all. So the normal lung exceeds the demand for gas exchange. In other words, the area of the lung is so large that more than enough oxygen is exchanged at the lung for the body, and more than enough carbon dioxide is released. So ventilation after training may be lower at the same work rate. Now there's a couple of reasons why that may be. One of them is that at lower work rates, or say pre and post training, if you're at the same submaximal work rate, then you're producing less metabolites such as lactic acid in the muscle, having less stimulus and less feedback to the chemoreceptors, and so that will result in a lower ventilation for the same amount of work, same power output, same running speed. So by pushing the lactate curve to the right, you're producing less lactic acid, less and other metabolites that may stimulate ventilation, and hence ventilation tends to be a bit lower for the same work rate. This graph shows before and after ventilation at the same work rate. So we've got power output in watts here and the ventilation on the y-axis. So before training, you're looking at, at 100 watts over 40 litres, at 150 watts over 60, and then at 200 watts over 80. But after training, you're looking at around 35 and 50 and just over 60. So there's a big drop in the ventilation after training, and this is due to possibly that there's less metabolic disturbance. In other words, there's glycolysis does not rely on the production of lactate. All the pyruvate's going straight into the mitochondria, and so there's less metabolites floating around in the blood, particularly hydrogen ions that may stimulate the chemoreceptors to increase ventilation. So therefore, after training, the ventilation is lower. So does ventilation limit exercise? So what is the limit to VO2 max? Is it the fact that we cannot breathe in enough oxygen? Does the respiration limit the exercise? So the capacity to increase ventilation during exercise is considered greater than the body's capacity to pump blood to the body and the VO2, the amount of oxygen consumed. So there's more than enough capacity via the ventilatory system to match the Q, which is the cardiac output, and the VO2 required for the body, even at VO2 max. So you tend to overbreathe for what you can pump around your body. So the alveolar surface area is really large. Like I said, it's around 50-75 meters squared, which is very huge surface area. The pulmonary blood volume is relatively low, so there's a very large surface area to the amount of blood that's moving into the lungs. So the alveolar partial pressure increases during exercise. So that means that the lungs tend to be over ventilated because of this partial pressure of oxygen in the alveoli is actually increasing, not decreasing. And that shows that there's more than adequate ventilation inside the alveoli. The pulmonary capillary transit time, so that's the time it takes for the red blood cell, erythrocytes is a red blood cell, to move around the alveoli. So there's a capillaries going around these little sacs, the alveoli, and it takes a few seconds for the red blood cell to go through that capillary network. It can take up to about 4 seconds. And even at max, that tends not to change. Okay, so the speed is still above the minimum required before. If it goes too fast, then it may not have time to take up the oxygen from the alveoli. It'd be going through too fast. Now, for some elite athletes, highly trained elite athletes, it does go through too fast, and they may, some of their red cells may not have oxygen attached. Yeah, but I'll talk about that later. But overall, for the average person, ventilation is unlikely to impact on performance. So it's not a limitation to exercise. So the VE-Q ratio during rest and exercise. So remember that it's the ratio of the ventilation to the blood flow going to the lung. So VE can go from 5 to 190 litres per minute. Even for some rowers, some of the really big male rowers, they can go up to about 250 litres per minute. The cardiac output, 5 to 30 litres. Okay, for an elite athlete, you might be looking at 30, 35, 40 litres per minute. But you can see there's a large difference between the two. Okay, going 5, and then we're going 190 to 30. So we're looking at 5 to 6-fold difference. And so you can see that ventilation, we tend to overventilate for the amount of cardiac output that's coming into the lungs. So most of the lungs are well perfused, or well ventilated, I should say, compared to the amount of blood coming in. And this is the relationship of oxygen consumption and cardiac output, and it's a linear relationship. So for every litre of oxygen, you're looking at about 6 or 7 litres of blood required. So if you've got a 5 litre VO2 max, you're looking at around 30 litres of blood going into the lung every minute, and then also pumped to the rest of the body. So the increase in ventilation, going from 5 to 190, is probably one reason why ventilation is not considered limiting. Does the pulmonary system limit exercise performance? Okay, so we've talked about ventilation, how much air is going in and out, but does the exchange of the oxygen at the lung, does that change at VO2 max? At low to moderate exercise, the pulmonary system doesn't seem to be a limitation. Now, at maximal exercise, it also doesn't seem to be a limitation at sea level. Maybe at altitude there is a limitation there, because the environment partial pressure of oxygen is lower at higher altitudes, and therefore you've got less of a gradient, which can result in less oxygen being transferred to the red cell. Possibly respiratory muscle fatigue when exercising for long periods at greater than 80%, but there's big question marks over that. Do the respiratory muscles actually fatigue? Or do the actual locomotor muscles, the leg muscles, arm muscles, etc., do they fatigue long before the respiratory muscles? Generally, respiratory muscles have excellent endurance capacity. Increase in pulmonary blood flow, greater proportion of Q. So in other words, at VO2 max, does the blood flow to the lungs, does a large portion of the blood go towards the pulmonary system rather than to the legs, say, for cycling or running? Okay, so because you're pushing air in and out so hard, you have to work those muscles hard. More of the blood from the lungs is going to the to the respiratory muscles rather than to the locomotor muscles. And then finally, we've got exercise-induced arterial hypoxemia, which is seen in elite athletes. So hypoxemia, so hypo, lower, xemia, normal oxygen in the blood. So how much cardiac output does ventilation require? This is an interesting study that looked to investigate that. So how much blood does it require to actually run the respiratory muscles? So they got 7 elite cyclists and they hooked them up to an assistive ventilator, which is this. So this is what you see in hospitals. They attached it to the cyclist while they were cycling, and then they actually pumped air into their lungs during the exercise. So it assisted their breathing, so their respiratory muscles didn't have to work as hard. So they had the ventilator increasing the assistance of their breathing, and then they also had the ventilator increasing the resistance. So they had to really work their muscles hard to go at the same speed, the same ventilation. And then they had no change in ventilation, so that was the control. And they found that around 9–10% of the VO2 to the legs was due to the ventilation. So in other words, about 9% of VO2 max goes to ventilation only, and the other 81% goes to the locomotor muscles. So a fairly large proportion of oxygen actually goes to just moving the chest cavity, the diaphragm, all the intercostal muscles in and out, not to actually moving